While the rest of Pakistan prepares to celebrate Eid al-Fitr, Omar Pasha is working the night shift in BANNU. Here, it is Chand Raat, yet he is working feverishly to drill a well for a solar-powered submersible. The goal is to offer a clean water source at the IKF-adopted rural healthcare facility in Ghoriwala, a suburban village in BANNU. 15 kilometers away, in the city of BANNU, at the Women and Children's Teaching Hospital, the IKF has taken operational control of one of the children's wards. The ward has been disinfected and wiped clean, it has been repainted, its faulty wiring has been repaired, and air conditioners have been installed.
Medical system is overwhelmed. So when the medical system is overwhelmed, you need doctors to come in, you need more medicines. So these mobile medical teams that we've had in vans have gone all over the area. IKF staff has provided the intelligence, the resources in which to go, know where to go. My team has provided the capability, the doctors and the medicines, and the IKF chairman and donors and board has provided very quick decisions, resources and money so that we can provide for the fuel, for the salaries, for the doctors and medicines, and everything that is needed in order to come into this very, very hot, very difficult situation so people could get the health care that they need.
The mobile health units, or MHUs as we will now call them, were deployed on July 6th. To date, they have provided basic health care to over 10,000 patients. Approximately 70% of them are IDPs, the rest local residents.
Now, when we do these mobile medical teams, we are doing basic primary health care. We're trying to fight infection, we're trying to avoid epidemics and fight them before they start. We're trying to see if an epidemic is taking place anywhere of cholera or tuberculosis or any of these things that we see evidence of. We will report that to the World Health Organization and to the local authorities.
With well over 500,000 refugees living amongst 1 million, infection and disease has spread to the locals as well. Not only that, the existing healthcare infrastructure, which was already overburdened prior to the exodus of IDPs, has been strained even further.
How are you? How are you, buddy? Oh, assalamu alaikum, how are you? These kids are suffering from diarrhea, there's, dehydration, they're suffering from measles, they're suffering from all of the common diseases that when you're in an emergency situation and people are congregated together becomes epidemic. It's things like scabies, which is not deadly, but it's very painful, itching, very debilitating disease that creates a lot of suffering, and it's very, very contagious. So we see a lot of these kinds of things. Obviously, children all together in one place, in so many different places, all living together in unfamiliar surroundings, people coming from a relatively cool place now to a hotter place. You can imagine the suffering that is going on day to day. There's not electricity in many areas, and even when there is electricity, the electricity goes out a lot, so people are just left to this heat, and you can see just how hot it is here.
I have heard great things about you.
Thank you, sir.
You're what's a human being. A human being. Human being is one, you are only human if you have humanity in you, compassion in you. Otherwise, you're intelligent animals. No difference. Some about that when you heard about